Good evening, everybody, and welcome to tonight's meeting. This is a public meeting and members of the public and press are permitted to report on the proceedings. Reporting includes filming, photographing, making an audio recording and providing commentary on proceedings. Please note the meeting is recorded and streamed live. These recordings are published on the relevant meeting page of the Council's website. By choosing to attend this public meeting, you're deemed to have given your consent to being filmed or recorded and for any footage to be broadcast or published. If the alarm sounds, the premises must be evacuated immediately. Do not spend time collecting personal belongings. All emergency escape routes are clearly signed, and once you've left the building, the assembly point is in the High Street opposite the Guildhall. Members and other public speakers are reminded to use their microphone when speaking. And as you can probably tell, I'm not feeling very well, so I'm going to speak as little as often tonight. Do we have any substitutes?
Chair, yes, we do have two substitutes. Andy Roberts is here for Stephen Hodgson. Jenny Barnes is here for Robin Norfolk.
Does anybody have any declarations of interest? No. Okay, can we take the minutes then? So if we go page by page, page 1, 2, 3, 4, 5. Everybody happy with that? Okay. We're having a slight change around of the agenda this evening, and we're going to take item 8 first. So Warwick, I believe that's on you.
Thank you, Chair. If members recall correctly, last November's 2021 meeting, the committee approved the work to be undertaken to develop a business case for the recruitment of a dedicated active travel officer. On that instruction, we've done some research and put together the following paper. This report provides a summary of the existing work being carried out, as well as the inclusion of a proposal for an active travel officer to be employed by the Worcester City Council. So to give it a bit of a policy background approach, you'll see in paragraph 2.4 that referred to the refreshed city plan that is due, which was approved by Policy and Resources Committee on the 14th of December for recommendation to full council later this year. Two of the themes are relevant to this particular piece of work. One is healthy and active city, and the other is enhancing and sustaining our beautiful city for future generations. There's a couple of particular items in those that relate to this area of work. One is reducing congestion and improving air quality, with the increased provision and use of cycling and walking routes, and the enhancements of the city's ring routes and radial routes. And then the healthy walking routes around the city are enhanced to achieve a 15-minute city where facilities are accessible for all. Then under enhancing and sustaining our beautiful city, there's combating the climate change emergency by reducing carbon emissions and increasing the opportunities to walk, run and cycle alongside the riverside, and obviously with the new bridge between Gallivelt and Keepax Parks, developing those links. The Council has signed up to a Sustainability Action Plan, which includes 3 projects relevant to this role. Mentioned in the previous report paper. One is there's 2 elements on staff improvement by mode change to reduce emissions for business travel, and the other is reducing emissions for commuting to and from work. The third project is the Active Travel Town Investment Plan project, circa £4.5 million of investment. And it's that investment that I've a bit more detail in 2.10, where it summarises the linking existing routes and the network, providing a new bike hire scheme for residents, providing routes to link deprived communities with employment, education and leisure opportunities, and then, as I mentioned previously, the bridge going at Keepax and Gallivelt, and then also enhancing the canal towpath between Diglas and Sixways, extending the riverside route south towards the Ketch, and new routes serving Ronkswood community. The Council also is looking to support future cycle storage when opportunities arrive, expanding on the popular provision within the Crown Gate Shopping Centre, which is like cycle secure provision. Worcestershire County Council have several infrastructure projects and in train and in aspiration. Those are detailed in 2.13. and 2.14. Then there's a summary of West Mercia Police action for road safety. As you can see in 3.1, the West Mercia Police and Crime Commission's road safety strategy was published in 2021, most recently, where it states since 2017, 12 cyclists have been killed and 185 injured in collisions across West Mercia, obviously including Worcester in that region. A lot of the incidents could have been avoided, as it says in this report, and therefore sharing the highway and more responsibility is an aspiration for the road safety team. And there are two operations ongoing by West Mercia Police. One is Operation Snap, which is using dash cam footage to follow up on incidents. And the other is Operation Closed Pass, which is police cycling and taking footage of where vehicles are passing cyclists illegally. So, proposal for the active travel officer would pick up on the existing issues with air pollution in the city. You can see in 4.1, the annual average of nitrous oxide and associated volume of is associated with the volume of traffic and street canyons. Worcester City acknowledges that this is an issue and declared the whole of the city as an air quality management area following the exceedances of the National Air Quality Objective. And activities to increase the number of commuters travelling by foot, cycle and public transport will reduce congestion and reduce the lost time in travel and pollution. So there's an active activity there to reduce the impact on residents. And also the Canals and Rivers Trust, which is obviously responsible for Worcester and Birmingham Canal, has a great campaign called Stay Kind and Slow Down, which it rolls out across its network, which is all about improving recreation and looking after others as you're using these routes. And seeing as the Worcester and Birmingham Canal is being used as an active travel route, this would give us an opportunity with joint events, activities, to provide information and promotion to help people transition to using this in a higher intensive way and hopefully improve the long-term success of the route. The Worcestershire County Council's Health and Wellbeing Board's #1 priority, which applies to all ages, is keeping the population active. The Joint Strategic Needs Assessment briefing on physical activity presented to the board in June 2019 identified that physical activity is an important component in health and wellbeing. Physical inactivity is the 4th largest cause of disease and disability in the UK and is responsible for 1 in 6 deaths. The Chief Medical Officer's recommended physical activity levels reduces a person's risk of a range of diseases as detailed in 4.5. And the recommendation is that someone should be active for 150 minutes or 2.5 hours of moderate intensity activity over a week, which ties in quite nicely with the 15-minute city. A commute of 15 minutes by walking or cycling would obviously provide that activity for people. The rates of adult walking and cycling for travel on at least 3 days a week are worse in Worcestershire when compared nationally. Of all the county districts, Worcester had the lowest proportion of 35 to 54-year-olds participating in sport and activity at 23.5%. The public health performance measures for the county indicate 2 potential indicators for this project. One is that 65% of adults over 18 are classified as overweight or obese in 2019-20. Obviously, we tried to reduce that figure as part of this project. And 20.6% are physically inactive adults over the age of 19. Again, a figure from 2019-20. As preferred option, as detailed in 1.1 of this report, the committee are asked to recommend a Policy and Resources Committee to allocate £100,000 of funding, revenue funding over a 3-year period to recruit an active travel officer. The role would be to engage with businesses, schools and communities to adopt mode shift STARS accreditation, a nationally recognised strategic way of mode changing people's perception of travel and how they travel. or a similar approach that provides an easy-to-use framework to create travel plans, monitor participation and recognises the rewards of best practice. The star system also gives you a gold, silver, bronze, so it can give you like a platform and a step change for the city. The officer could champion City Council staff to take up the existing initiatives that are identified in the Sustainability Action Plan. They could support the development of the town's investment active travel project. They could develop new and existing multi-agency partnerships to explore and promote new approaches to delivery and engagement. As part of the integrated care system, work with and support partner agencies to identify, map and promote cycling, walking and healthy walking routes, again linking back into that 15-minute city. And then also support interest groups like Bike Worcester, Transition Worcester and Healthy Walks to encourage activity and also run an events programme to promote both walking and cycling. And then, but also promote that inclusively across communities and also look for opportunities where there are barriers to engagement and identify ways to remove those barriers. The active travel officer could also monitor, evaluate and provide evidence and case studies to see what works and what doesn't work in the delivery of the town investment plan to look at adaptations or changes in future. The suggestion is that the post would be part of the environment and sustainability function of the council and report under the Deputy Director for Corporate Policy and Strategy. And as requested at the last minute meeting, there was a recommendation for a number of performance measures that the active travel officer would be responsible for, and those are detailed in 5.5. Any questions?
Thanks, Warwick. Does anybody have any comments or questions on this? Karen?
Oh, hello. Can I email you? Someone's got in touch with me and they're wanting to set up a bike repair scheme near the Crown Gate to support people having punctures and things like that. He repairs bikes and he keeps getting asked to do it, so he wants to set up something a bit more formal. But it would be free for them to use if they have to pay for parts. I don't know if that would fit in quite well with the sort of maintenance as well that we're talking about. So if I contact, I mentioned to Shane earlier, I didn't realise you were the person I should be talking to as well. So I'll forward you some details from that. Okay, thank you.
I think it might be worth mentioning that there is a bike repair centre in Crown Gate where you can lock up your bike. But I'm not sure that it's got much to do with the active travel officer post at this point.
Yeah, Mike Lloyd actually asked this guy if he'd look into setting up something, and he's looking into do something Thursday to Saturday. But it's but then it's how he's going to fund it. Because which I did say, I mean, you know, you can't be doing this for free.
Does anybody else have any questions, Mike?
Thank you, Chair. Does the fact that the report doesn't include some sort of case study, there must be these sorts of posts already established, and I would have hoped to have seen some evidence of the impact it has.
No, we haven't included case studies from other locations. What we have found, obviously, that each location is very unique. Worcester City is very different to Wychavon. That's why we haven't really used any cases from Wychavon, because it's parish council focused, that particular project. Yeah, point taken. Sorry, I haven't included a case study from another location, but I mean, certainly it's something I could go and research if you like.
It's just a bit of a concern that where's the evidence that would support the 100 grand or whatever it's going to cost us over 3 years? Because we actually need to see a positive result out of it. I haven't got a problem with the proposal, but is this the right way of actually getting a result, I guess?
Without obviously providing a case study, I mean, part of researching the report itself, there are a lot of active travel officers across the country, either at county council level or borough council level. So there's a wave and obviously a signed up mantra for doing it, rather than being groundbreaking, I suppose. That there's a precedent elsewhere for it.
Through you, Chair, I think it's a fair question asked by Councillor Johnson, but I think one of the things we as officers recognise with this post is Worcester City having a stake. So there's lots of work going on around the county around active travel at a county-wide level. But as Warwick says, through the work we've done, I think it's really important that we have somebody in the game, in effect, who's sort of punching for Worcester City and shouting for Worcester City. So we can harness what's going on and make sure we get as much of that for the city as possible.
Richard?
Yeah, thank you, Chair. I think there's a lot of opportunities here from this project, and I think there's a lot of projects and plans and ideas which this officer could actually utilise and bring to fruition. I know, for example, somebody mentioned to me over Christmas that they've got a lot of bikes and garden sheds across the city which are in need of recycling, and there could be a redistribution of cycling going on across the city with people handing them in and exchanging bikes for children who've grown bigger or smaller or whatever. But the issue about the point about constant review of this post, if it's actually appointed, I think is important to know what this person is doing and how they are actually achieving change. And I think active travel officer would have to come, I would hope, to each and one of these health and wellbeing committee meetings to actually explain the progress of the work which they're doing, to explain the advances which are being made, and to actually ask for help and advice if there is a need to change direction. I think constant review of the post over the 3 years may be a worthwhile exercise and would bring members of the council more up to date with the activities of active travel.
Steve?
Yeah, thank you, Chair. I think it's right to say that last time that the proposal came forward, I know members on this side were certainly asking a lot of questions in relation to how the role would sort of pan out as much as anything. And I've got to say, short of what Mike has just raised, those questions have indeed been answered, I think, by by Warwick in his report, particularly in relation to the role profile. But I think more importantly, what Richard alludes to, the way that the targets are measured, whether they're smart and measurable and etc. In relation to that, I think is the important point. And in many ways, we're not going to know that until we get there. But the fact is that in the main, the questions have been answered, so I'll be happy to support.
Yep, got Jabba and then Lloyd.
Yes, thank you, Chair. Really good set of interesting proposals here regarding the active. Because one of the key questions I had was regarding how we're going to measure the success. And a personal question to you is, what would success look like to you? Because I know you, in terms of at the end of the 3 years, what would you have liked to have achieved at the end of it? I know it's a really a passion of yours to get Worcestershire moving, so it would be really good to hear from your perspective, Chair, that. The other question I had is, do you think that, what other resources and support will this officer be given, because that's crucial really in terms of inter-council support and county support in order to make the best success of this post, because we know there's obviously a mixed view of feelings and regarding this, and everybody has to work together. So, we need to ensure that everybody's singing off the same page to make sure that this is a rousing success.
You've put me on the spot there, and I said I didn't want to talk very much tonight. For me personally, you know that this is a big passion of mine, and success for me would actually be more people getting out of their cars. It would be when I come into Worcester to go to work, there is less people in cars and there's less traffic. But also I think really success would be adequate cycle provision from the county council. And I think one of the things that this active travel officer will do in conjunction with organisations like Bike Worcester and Transition Worcester is they will be there as almost like a lobby, as a pressure group to encourage the county council to provide decent active travel infrastructure. At the moment, we've got canal towpaths being resurfaced, and that's not active travel infrastructure, that's a canal towpath. It's not adequate cycling infrastructure. It's great for leisurely cycles with your family, it's great for walkers. It's not good to encourage people to commute by bike, particularly early mornings and late evenings in the winter. It's not adequate. So for me, this measure of success for this will be decent cycle paths, decent roads without massive potholes on the side of them. It will be having more people cycling. It will be, when I come into Worcester, it's a little bit more like Evesham or Pershore or Oxford, where people are cycling and they're walking and fewer people are using cars. Lynn, I have you next, I think. Sorry, Jen,
So just the...
Remind me what it is again.
In terms of the associated support resources for the post.
I think that's one that Lloyd can take on.
Yeah, thank you for that, Chair. I think we envisage this post reporting to somebody quite senior in the organisation, probably at the Deputy Director level, and they'll certainly sort of sit within the current small team that overlook environmental sustainability and biodiversity, so there is some sort of natural synergies there. I think the other point that's been made tonight is making sure that the officer is well connected with other colleagues, not just from across districts, but at county council level as well. We've got Matt here from Public Health tonight. That would be another important team to be linked in with. So I think from point of view of management, senior level in the council, they're also well tapped into other colleagues, both from public agencies and non-public.
Thanks, Lloyd. Lynn?
Yes, thank you very much. Absolutely welcome this, and thank you to Warwick for a really good paper, which, it's absolutely clear that this project is completely in line with our city plan, the refreshed city plan, and there is so much evidence. I feel a bit silly saying this in front of Matt Fung, who's the public health consultant, but a key part of public health and ill health prevention is about getting more people more active, physically active, and that, walking and cycling is absolutely critical to that. Worcester is actually a very compact, walkable city, but it doesn't always feel like it. And I think, this post will give an opportunity to realise that more, help more people become more physically active, reduce car usage and petrol usage, and hopefully also improve air quality within the city, which is, again, a public health factor that is of considerable concern, and I'm sure we'll hear more about it later. I know there's kind of some concern with regard to the costs, and I understand that, but it is a 3-year project. The salary is actually relatively modest. It's an average Worcester salary at the bottom end, or only just above. And it is for a 3-year project, and I think that is important. That gives a chance to actually work with, get into communities, and actually to make a difference and a step change in how people get to move around Worcester. So yeah, well done, and I hope that I'll move the recommendation.
Thanks. Do I have anybody else?
Thank you, Chair. I think it's a great step forward. I just certainly think 3 years is necessary to embed the whole idea, so that it isn't just a 1-year situation. And I think it's really important as part of a balanced travel solution. Crack on with the walking and cycling, and hopefully next you can sort out the buses. Thank you.
I think that one might be a bit out of our remit, unfortunately. Thank you so much, Warwick, for this, and thank you for entertaining this notion that I had of looking at an active travel officer. It's been a lot of fun getting it to where it is now. And I really hope that we can all be in support of this, because I think it's a really good thing for Worcester. It's great for getting people, out of the car. It's great for clearing up our air pollution. It's great for encouraging people to, just be outdoors. And like Lynn said, the city is very walkable. Worcester is tiny. It's a big town more than anything, really. You can walk from one end to the other in about 20 minutes. So we should not be encouraging people to drive from one end to the other. We should be encouraging them to walk and cycle. So I think if we can vote on it, everybody in favour of this? Yeah? Any abstentions? Anybody against it? Okay.
That is carried.
Thank you. Okay, so we'll go back to the beginning now then. So Matt, if you'd like to present your report.
Thank you very much, Chair. Are my slides going to appear on the screen? Great, thank you. And I believe that you've got a copy as well. So thanks very much for having me back. It's been a few months since I was here last time to talk about some Worcester City public health indicators and just to give a brief about the state of the city from where I sit. And this is really an update on that previous presentation. Since then, if you go to the next slide, please, some indicators have changed and been updated. And in fact, we have completed our JSNA annual summary, which was presented to the Health and Wellbeing Board back in November 2021. And these are broad, high-level indicators. They give a bit of a temperature check for where we are at. And as you might expect, life expectancy, healthy life expectancy in Worcestershire perform relatively well compared to England. And you would expect that for, say, a relatively affluent county such as Worcestershire. And then you've got another green blob there, which is between 2016 and 2018 mortality rates for cardiovascular disease, cancer, and respiratory were all better than England. So that's fine. That presents a state of health for a lot of people when you average it out. However, we do have a number of significantly worse than England indicators. Those are in the red box, so persistently red: excess weight in adults, alcohol-related admissions to hospital, breastfeeding, smoking status in pregnancy, school readiness, fractures. So a few, as I say, really important indicators that don't seem to shift from year to year. And what I should really highlight again, because it's really important, is even though we have a lot of green indicators, there aren't actually that many red indicators for Worcestershire. When you look against England, what that does is it buries the difference between the most and the least affluent in the county. So because a lot of people are affluent, those who are most deprived won't necessarily show up and flag up as they do in other areas, and that's really important. At the bottom are some of the challenges as a result of COVID and wider issues, like you've got mental health challenges down there relating to unemployment, bereavement, long COVID, and frankly, COVID in general, inequalities in mental education and academic challenges, school readiness, challenges that have been exacerbated because of COVID, are yet to really present themselves fully. And so we need to be really aware that what we're seeing now could get significantly worse. So some of these indicators, yes, they're the most up to date, but they don't take into account the full extent of the pandemic to date. Then you have some access challenges on the bottom right-hand side there of those boxes, particularly for kind of deprivation and ethnic group linked as well. So that frames, in a nutshell, some of what we're seeing when you look at the global indicators. Next slide, please. So, as I was alluding to, really, COVID-19 has had far-reaching impacts and consequences. It's disrupted services, and particularly those who are more deprived, who perhaps went into the pandemic with poorer health and well-being. And we can really see that through the data that was coming through to us in public health and the health system. Inequality is exacerbated, I've already mentioned that, but particularly for children and young people, for older people, and for more deprived people. Those kind of broad groups of people have really been disproportionately impacted for various reasons, and we'll go into some of that a little bit later. Next slide, please. But when we look at Worcester City indicators specifically, you may have to look at your packs for this because the text is quite small. Some of these indicators here are health focused, absolutely. I just wanted to give you a flavour of some of the things that are red when you compare Worcester City to England. So this is what is presented on the dashboard. So life expectancy at age 65 for women is significantly worse in Worcester City than England. That's a red indicator. Emergency readmissions within 30 days of discharge, again, a red indicator for Worcester City compared with England. That's quite an interesting one, and obviously it's health service related, but also potentially related to the health and well-being of people in Worcestershire as well. It's a broad, high-level metric. But then you get on to absolute and relative kind of low-income families, so children who live in low-income families. That's a red indicator there, again, in Worcester compared with England. Loneliness, again, red indicator. Cancer screening coverage for cervical cancer. Chlamydia detection rates, estimated dementia diagnosis rates and hip fractures in people aged 65 to 79. So there are a few red indicators there, some of which are absolutely health focused, some of which can be influenced by the City Council. So we can talk about that again a little bit later. Next slide, please. But before we go on to a couple more slides that are really important for this particular presentation, I just wanted to flag employment. At the point that I presented last, employment had absolutely kind of plummeted below that of SIPFA, so statistical neighbours to Worcester City. So it was, on your graph, it was around about Q1 2021, so it really hit rock bottom there. But in the last 2 quarters, it's really come back up again. So what we're seeing is clearly employment in Worcester City being slightly more sensitive to disruption, as we've seen in and through a pandemic, through COVID, than some of the statistical neighbours to Worcester City. And we've now come right back up and actually exceeded that of the average of our statistical neighbours, which is it's important. It's an important barometer metric of recovery in Worcester City. Next slide, please. If you click once more, that should show the first graph here. So what I wanted to do was just to highlight 3 separate slides, which were some evidence from research from the University of Sheffield. And this is a chart showing percentage of households experiencing hunger for Worcester City and statistical SIPFA neighbours. So hungry being defined as having skipped food for a whole day or more in the previous month, or indicated that they were hungry but not eaten because they couldn't afford or get access to food. So in Worcester City, 4.28%, so below the average line for statistical neighbours, but that's 4.28% of families in Worcester City who are declaring that they are experiencing hunger. The average line isn't the most helpful here because you have 2 authorities that are really very high, so that skews the average up. So we're round about, if you were to exclude those, then round about average for Worcester City, so 4.28%. If you click once more, please. Struggle. This is households experiencing struggle with food security, defined as a positive response to having sought help to accessing food, skipped or shrank a meal, or gave a reason for not having enough food within the household. 13.56% of households in Worcester City have struggled during COVID with accessing food. So that's another significant finding there, above the average for statistical neighbours. And just click once more for me, please. And this is being worried generally about food security. 10.5% of people in Worcester City were very worried or fairly worried about getting food. So it paints a picture of a significant number of households and people in Worcester City who are struggling with food, worried about food, or kind of having experienced hunger in relation to providing for their families, their households in that food environment. So for me, that was really quite a stark set of charts. If you click once more, please, and then this will go on to fuel poverty. This obviously is set against a backdrop of a fuel crisis in the UK. Every authority is going to be affected, but again, disproportionately, the burden will fall on our most deprived communities and households. It's fairly obvious. This data here is taken from 2019, so it's the most up-to-date snapshot that we have for fuel poverty. This is before any crisis, this is before COVID hit, before unemployment, before furlough, etc. And we are at round about 15.5% pre-COVID for fuel poverty. I should say pre-COVID and pre the fuel crisis for fuel poverty. For me, this points us to a situation that could really escalate quickly once the price cap comes off beyond April. I think that families that are struggling already will continue to struggle and potentially struggle even more following all of that that's happening. So, as I say, this is not unique to Worcester City, but we need to be aware that we have a significant number of families who are struggling currently, who will struggle even more beyond April. And frankly, I have no idea, none of us know where fuel prices are going to go. We don't know how that's going to access food. Well, we do. Prices are going to go up. So where we see struggle already, where we see hunger already, I think that's going to be exacerbated. And so I think we need to be prepared for having some kind of response from a city level. Not just city, I think it's a partnership level, actually, and one that all partners need to own. And just coming on to partners, primary care networks. Many of you may not know much about PCNs. We have kind of this collection of GP surgeries that kind of try and operate at a place-based level. They commission for their populations. They work for their populations. They have plans, and this is part of the Worcester City PCN or District Collaborative Plan here that you can see. So things like supporting diabetes, having a diabetes tour bus, kind of focusing on rough sleepers, drug and alcohol misuse. So you can see some of the priorities there, which are kind of arguably clinically based. They have branched out into some wider determinants, like the drug and alcohol misuse, but actually it's through PCNs that we need to get data, and PCNs where some of the solution lies to some of our issues, referring into the right kind of services, linking up with housing, linking up with, referring to an active travel coordinator. There's opportunity that we can start to leverage when we work, not just kind of in a silo, but when we start to look outside. PCN kind of priorities and PCN opportunity. Next slide, please. So on recommendations, last time around you set a challenge back to me, which was, so what do we do with some of these priorities that we can highlight? As I say, what I have presented today has really drilled down into poverty, food poverty, fuel poverty, some things that are going to be inflamed, exacerbated by current crises going on. So loneliness, we can all work together to identify people who are lonely, signpost to community activities, improve computer literacy, co-develop interventions, use walking groups and cycling groups and opportunities that exist in and around the city to get people out and about. Fuel poverty, identify vulnerable households, warmer Worcestershire and initiatives like that, which we're hoping to get off the ground again very shortly. I think we all need to work together to point people towards grants and schemes that can help. Child poverty, economy and employment, really critical in that. Benefit optimization, working with schools. We have schemes that are being worked up, community fridges. We're just doing a needs assessment on food poverty in Worcester City to really drill down into some of that data, to understand where people live, to kind of look at free school meals and all of the data that we can gather together. So there's food poverty there as well, mentioned some of that already. Inequalities more generally, link up with partners, NHS, PCNs. Continue to advocate COVID vaccination, and beyond COVID, other things that people who are more deprived, perhaps, that don't access screening, broader vaccination, getting people into the right services where they could kind of benefit. So there's a lot that we can do when we work together. I'm just going to pause there because the next section is a little bit different. So are there any questions or comments on that, or really happy to take questions at the end as well?
I think now's actually probably quite a good time to take some questions, and I'm going to use my chair's privilege to ask you a couple first before letting anybody else get in. So I had a baby during COVID, so I spent part of 2020 pregnant and then 2021 with a newborn baby. So some of the things that are coming out of this I think are quite concerning with regards to things like child poverty, but particularly on your first slide, issues surrounding things like breastfeeding initiation, smoking status in pregnancy and school readiness. My oldest daughter started school in 2020, so I feel like I've hit all those milestones during COVID. But I know that Worcestershire Acute NHS Trust is a UNICEF accredited baby-friendly trust. So it has reached all those accreditations for things like breastfeeding support. And I'm wondering if there's, what the reason for it being a red indicator is for breastfeeding, because there is obviously support there. The hospital does not provide formula milk anymore as a way of encouraging women to breastfeed. And I wonder if you can tell me from a public health perspective what you think has gone wrong there, because I know from my own perspective, there was no support during COVID, and I think it's only just starting to reopen back up again now. Have we seen numbers of women breastfeeding, at least for the first 6 weeks, really plummet in the past year? And what is the sort of wider implication for that? So that's my first question. I'm going to give you a couple all in one go. But then the second one that I had was things with the cervical cancer screenings as well. I know that particularly from sort of my age group, we've all kind of had the impact of the Jade Goody awareness factor, and lots of younger people have had it flagged up to them how important it is to go and have screenings for this. Is there something that we as a district can do to encourage more people to go for screenings? Is there something that we can do? Because I know we've had things like for diabetes. What can we do for that? Because that is, it can be a real killer, obviously, and it's preventable. Lots of these things are very preventable if they're caught early enough. So really, those were my two questions, is about breastfeeding and cervical cancer.
Thanks. Is my microphone still working? Yeah, great. Breastfeeding, I mean, the thing is about all of these indicators that there is always an inequality split. So people who are more deprived are less likely to breastfeed, less likely to go for cervical cancer screening, less likely to get vaccinated. And that's a trend that we see all the way through. Now, services have absolutely been disrupted during COVID. Breastfeeding support and support groups and NCT classes, all the rest of it. People who are more affluent will seek ways in which they can support themselves, and where services aren't perhaps spending as they should be or were, can be a real barrier for people who perhaps don't have recourse to such, finance and kind of interventions. I need to get an update from the Trust. I think, we're coming out of the pandemic. I would expect things to start to settle down now in terms of that support. But it's something that is absolutely on our radar now. You clearly know some of the benefits of breastfeeding and, how that can set a child off on a much better heading, really, than formula feeding. That, some women really struggle to breastfeed. That will be a small proportion there. The majority should be able to, with the right support, breastfeed their newborn child.
I mean, just to interrupt on that, after I had my first, I worked as a breastfeeding peer support worker at the hospital. So, I did quite a lot of this stuff. And one of the things that always really strikes me is, as you've just said, those who are more affluent are more likely to breastfeed, which really seems skewed to me, because formula milk is incredibly expensive. And that can be a real barrier to some women, is the cost of formula milk. So are there any policies or programs that we can do as a district council to help encourage women to breastfeed as a cheaper alternative as well than formula feeding?
Absolutely. I think it's a great point. I think there are also, though, lots of reasons why women may choose not to breastfeed. So it's not just a one homogenous reason. There's the body image thing. There's kind of, it's your body. You should try and get back to normal as quickly as possible. And that, I think as an authority, there are some kind of low-hanging fruit that can be achieved, such as creating those spaces for breastfeeding, normalising the fact that we expect people to be breastfeeding. I think from your perspective, that could be one area. You may already do that, but to promote that more, I think clearly something's going wrong with breastfeeding in Worcester City in comparison with other areas, hence why we've got a red indicator here. So I think, again, it's a system thing to normalise outside medical or healthcare setting, and to get people used to the idea that people will breastfeed. On cervical cancer, I think it's a similar debate. There is a deprivation split. I think there's an embarrassment factor. There's a factor of I don't feel like it's going to affect me. I think there's something in the HPV vaccination as well for younger women that's starting to play in. But it's a really important scheme that, again, where there's opportunity to get on the back of, promote cervical screening and other screening programs, to be honest. Bowel cancer screening, that's huge as well. I think that we should take the opportunity through UN comms channels.
Thank you very much. Richard?
Yes, thank you. And you've asked us to also, in your recommendations, to consider wider inequalities. I just wonder if you could comment on something which has come to my attention over the weekend. It's inequalities which particularly impact upon lower income families and communities, and that's the issue of sexual health and the concerns which have been expressed to me recently about that. For instance, I understand there are no walk-in clinics in Worcestershire anymore, and that service has ended, probably, I'm assuming, due to COVID, but whether that's likely to be restarted again. Also, issues relating to access to contraception, including emergency contraception. The story I heard at the weekend was a girl couldn't actually find any emergency contraception, as she didn't have more than £30 to spend to purchase it, and had to actually use relatives and friends to actually borrow the money in order to gain access to emergency contraception. And whether we do an adequate kind of outreach work, especially with the reduction in youth work facilities which are going on, which have been going on for some time. And on a limited linked basis, also I'm very interested to know if you've got any data or information about the work which you've been doing regarding honour-based violence and FGM issues, whether there's any success in that in Worcestershire, and whether there's actually been any data which you can actually help us with to see whether there's been a problem which we should be aware of.
Thank you for those questions. I think you hit on a really important point of sexual health. Obviously, a huge range of issues there, ranging from contraception through to sexually transmitted diseases, and access to kind of resources and services. I think that, as I said, there's a range of issues here. There's the education, there's kind of knowing how and where to access contraception, not just emergency contraception, but kind of preventative as well. I think that, as you've highlighted, services have been disrupted. Where people are flagging there's a specific concern, absolutely we can take it back to our services. We commission, obviously, sexual health services from public health. So your feedback and feedback from service users is really valued in that. You did mention, sorry, what was the second part of the question? So it's contraception, and was there another part to that?
Contraception, emergency contraception, outreach work, reduction of youth work provision, and the honour-based violence and FGM. FGM,
that's right. We obviously have some data on FGM. Our primary care colleagues would be able to supply us with a lot more kind of granular data on where we may have an issue. It's not something that I have personally picked up from my conversations with GPs and with the NHS. That said, it's not that it doesn't happen. I'm sure that we will have some cases across the city. If that's something of interest, then absolutely we can have a conversation.
Karen?
Thank you, Chair. Going back to the vaccination and younger people, we're trying to encourage people to take up the COVID vaccination. But I mean, I've got a sort of a friend who's anti-vaxxer at all levels, and her baby daughter didn't even get a tetanus. So at some point, is there any programme or something that would allow that individual to become aware that they've not had these vaccinations? I don't know if a GP would reach out, if they check their records and realise that these children have missed out, and what age the child themselves would reach before they could do something themselves, whether something confidential could be done through schools and colleges to make that awareness, you know, have you had that protection? And as your rights as an individual to get that protection. Thank you. It's
a really interesting point, and I think it's a wider point about the work that our general practice colleagues do. So, I mean, you take COVID vaccination. So GP practices will be scouring their own databases and providing messages, alerts, calling at patients who haven't had a COVID vaccination to see whether they've missed by accident or whether they've changed their mind. With childhood IMS, I'm not aware of such a programme that happens routinely. Childhood IMS, obviously, people get their letters and parents will generally, in the main, go and get their children vaccinated. As I say, I'm not aware that anything takes place that kind of acts as a catch-up for tetanus or other kind of childhood immunisations. But it's a great point, and I'll send it back to our commissioners in NHS England. I was going to say PHE then, which is no longer, in NHS England to try and get an answer, because I think it's a great point.
Jabba?
Yeah, thank you, Chair. I mean, one of the most alarming statistics coming out of here is about the rates of obesity within the county, in terms of the 65% or above above the national average within that. And obviously, a lot of this, some of it may be due to lifestyle choices, but a lot of it is not inability to access services and health provision, and that is particularly true amongst the ethnic minority populations within the city. I mean, virtually women over the age of 40 within our communities, it's about 95% inactivity in terms of that. So, part of the reason is obviously the service is not, predominantly the service is not available. Part of it is the fact that they feel not safe going out in the early evening, especially during winter, in terms of the amount of hate crime that they experience on the street, which has increased post-Brexit, and with some of the stuff our Prime Minister's saying it doesn't help either. So all of these indicate that some of the stuff that we've, the active travel post that we've just approved in the preview is going to certainly help in that. So there's a lot more work that needs to be done to delve into specific communities to help them to access these services. Now, two examples that I can give in terms of obviously public health, which we've been working on in terms of swimming for women within the community, and an older persons group, which have managed to set up. Now we've got access to them to be able to find out their views, what they actually need. And I urge obviously the County Council and the recommendation of these reports to come and talk to these groups, see what is actually needed so we can tackle those entrenched inequalities.
Absolutely. Thanks for your comments there. I totally agree that if we are not careful, we can exacerbate existing inequalities through even interventions that we put into place for the best of reasons and with the best intentions. So it was actually making me reflect on the active travel officer that you were discussing before. We need to make sure that is targeted towards groups that perhaps don't access active travel currently. If we don't, what will end up happening is we'll put into place lots of nice plans and walking routes that people who currently are active will go and access and say thank you very much. What that does actually is it drives up inequality, it doesn't reduce it. So we need to be really targeted at groups that are not typically the groups that would engage with an active travel plan. How do we get into those communities, whether they're ethnic communities or more deprived communities or deprived ethnic communities? And I think that is the opportunity for me, but also the risk. Because I don't think it would be anybody's intention to actually drive a wedge between the most and the least affluent, and that's what often happens when we put into place these things. So yeah, I think your points are absolutely right, Councillor Riaz. I was just reflecting as well on an intervention that we are currently trialling in public health, which is it's resistance bands, actually, the stretchy bands that you can use. And we're doing lots of kind of pilots on this, and it's going through academic kind of publication with the intention that we're going to get these things out. So it's not active travel, but what we are going to be doing is exactly what we just discussed, which is working with different groups, not just, groups that typically engage, but working with ethnic groups, working with, let's say, more deprived groups and community hubs and that type of thing. So we're very cognizant of driving inequality from a public health intervention standpoint, and I think where we can help you as well to kind of tailor and target, we're here to help in public health.
Thank you very much. I don't think there's any more questions, so I don't know if you want to move on to the next part of the presentation.
Sure, thank you. Great, so we're really excited today to be launching the new health and wellbeing strategy consultation. It's a 10-year strategy, so long time frame, with the thinking around this that it takes a long time to affect change, to be able to record and report it, and to show that something positive has come of a strategy such as this. Next slide, please. So obviously it's all about health and wellbeing of people who live and work in Worcestershire. The idea of it being a 10-year plan, obviously it's a long plan, but it's going to be a living document that's going to be evolving. As we know, things can change so quickly. 6 months ago, we didn't have a fuel crisis. Now we have a fuel crisis. So we need to be able to, adapt and change as things move on. So this particular strategy obviously has paid due attention to the JSNA and various reports that have been presented to the Health and Wellbeing Board, and we've come up with this particular proposal. So if you go to the next slide, please. A bunch of numbers here that starts to frame how we arrived at the proposed priorities. So, the proportion of people who are going to be older, so 85 plus in Worcestershire by 2032 is going to rise by 51% to 28,450 approximately. That is a huge increase, and with it comes a huge increase in a lot of the conditions associated with older age, dementia. 4,370 people currently in Worcestershire living with dementia. If you do the same proportional increase, another 50% on top of that, that's 6,000 people in 10 years' time that may have dementia, some of which is preventable through healthy living and healthy living at all ages. And, there's a bunch of other stats there. We've talked about overweight and obesity. We've talked about fuel poverty and employment a little bit, children and young people mental health as well, where an increasing number of children and young people are reporting concerns with their own health, mental health and well-being. And then you've got depression there as one of those boxes, again, which is increasing over time. So a picture of, a complex situation, a complex kind of array of diseases and also wider determinant issues like unemployment that impact on mental health and well-being. Next slide, please. Being well in Worcestershire, I won't read out all of those paragraphs there, but on the right-hand side, you can start to see some of the kind of core determinants of health. So 40% of your health and well-being is made up of your socioeconomic factors, 10% physical environment, 30% lifestyle factors, and 20% healthcare. So it's quite interesting, isn't it? Healthcare being one of the lower factors that influences your own mental health and well-being. Next slide, please. So this is the nice, colourful slide, the kind of the thing that we want people to really get their teeth into and say, actually, this feels right, or this doesn't quite sit right with me, and this is what the consultation is all about. So top priority, good mental health and well-being, which, as you've just seen, is supported by healthy living at all ages, safe, thriving and healthy homes, communities and places, quality local jobs and opportunities. And we think that by getting those things right, it's going to really help with good mental health and well-being. Because as you saw before in that previous slide, actually very little of our mental health and well-being is actually influenced by just access to health services. Next slide, please. So this starts to frame the types of things that we need to support good mental health and well-being, to help us to live well at all ages, to have a safe and thriving community and those good local jobs and opportunities. And again, this is not just, although it's a health and well-being board, it's not just owned by public health. We obviously write this stuff. It's an entire system kind of operation, and it needs everyone to really get behind this, because so many, as I hopefully have described today, so many of the solutions and so many interventions sit at district council level. So many interventions sit within our PCNs and the NHS. Yes, public health, we have our services that we commission and things that we can do, but by no means do we have control over all the things that are kind of outlined and framed within this strategy consultation. So next slide, please. So the ask of this group really is we would love it if you could not only contribute and kind of comment on the consultation, but also promote this amongst your networks. I have just a few literally hot off the press flyers that have just come out today. So I'll leave these with Warwick, and please take one of these if you can make use of it. And point people to our website where you have a conversation with your constituents or with your groups. Please say there's this consultation open. This will really drive change. It's not just a consultation for the sake of having a consultation. Yes, it's statutory. The whole Health and Wellbeing Board are behind this, so that includes the NHS, the council, district representatives, our hospitals, the police, BCS, etc., etc. So it's really as many people and players around the system as we can get behind this. So that would be really helpful. And on to my final slide, please. I just wanted to end on this. My day job, part of my day job is data intelligence insights. We've just launched a new website called Worcestershire Insights. It hasn't had a formal big bang launch yet. We're iterating it into being. This is a hub of information that is not just high level. You can drill down into your ward. You can drill down into very small levels of geography, pull off your reports. It's all live data. So it's all sitting there as a resource, a tool for you to use if you would so wish to access this. We'll be using it to support our JSNA. We were really excited to launch it. It's going to host our JSNA resources and reports on there. But it's all interactive, and you can, as I say, drill down and click on stuff that you find interesting. So that's there, data.worcestershire.gov.uk. And on that, I'll end. So thanks very much for your time.
Thank you very much. Does anybody have any questions or comments? Lucy?
I'm quite interested to know about, you've talked all about the interventions for the minority. How about the interventions for the majority? Whether it's diabetes, whether it's overweight and that sort of thing. What are you actually going to do for those people as well? Because I think it's really those people that perhaps they think they're all right, but they're not. What are we going to do about that?
Great. It's a great question, and so thanks for asking it. In public health and health, we talk about proportionate universalism. So that means, very jargony, that means that you almost have a triangle of intervention. So for the majority of people, it's not that there's no intervention at all. It means that there's a universal intervention that is accessible to all. And the point about it being a triangle is that the nearer the top you get, the more intensive the intervention gets, and therefore the kind of different strategies that are needed to address need within kind of smaller groups. But it's not to say that there's not an intervention or an offer for the majority, because absolutely there should be. You know, when you've got 60 or 70% of people who are overweight or obese, absolutely you need a population level intervention as well.
Then?
Yes, thanks, Matt. It's always good to listen to an enthusiast that understands their subject and just say, this is the man behind the COVID dashboard. Which, you know, again, has live data. Thank you. I think we're quite honoured, actually, that the draft strategy was launched today, and here you are tonight, coming to Worcester. I think absolutely, for colleagues, the reason that this committee exists is here, that at district council level, we can have the profound effect on the environment in which people live that affects their lives. I'm just thinking of, off the top of my head, I've been contacted by at least 2 examples, since Christmas, of individuals struggling with their mental health. A single mother living in a 1-bedroom flat, wanting improved housing, but that's having a profound effect on her well-being, the lack of, and a family with 2 children, 2 preschool children who live up 2 flights of stairs and there isn't a lift, and their housing circumstances having a profound effect on that family. So how we plan our city, what housing we have available, how easy it is for people to move around, and the skills and the economic environment. I think the picture that you've given us is really helpful. I have to say that the data, the 2019 data on fuel poverty is really frightening when we know where we are today, and so fearful for what comes ahead. From a public health perspective, what do you think is the best intervention with regard to that?
It's a difficult one. Is all I can say on one level. We have our Warm in Worcestershire programme. We fund a post out of Public Health Ring-Fenced grant to look at bids and try and get in grant funding. We have on the horizon, there's the housing support grant at the moment, so that's fine. That's going to end at the end of March, I gather. Beyond that, we have on the horizon a kind of extension of that around boiler efficiency and insulation, and trying to get people's bills as low as possible. The problem, I suppose, is that I'm not sure that's going to be enough as a system. We're only talking dozens of houses, not hundreds, across Worcestershire, not just Worcester City, that are eligible for these grants, that have deficient heating systems already. So yes, we can pull a few people out of potential fuel poverty, but it won't impact the numbers that we're seeing, I don't think. I think it's going to be really important to ensure that people are accessing the national benefits and grants that they're entitled to. I think that's going to be really important. I imagine that there's going to be a surge of people wanting, advice around debt and kind of fuel debt, particularly. And I think that we're going to have potentially more people on standby to start to advise and to kind of counsel people actually through this period. Beyond that, I I think we'll have to see where this thing takes us and actually what we're legally permitted to do. As I say, there are some uninsulated houses. You know, you have Insulate Britain who are still kind of getting out there. I'm not sure that by itself will not solve the fuel crisis, insulating houses. It will help some people potentially where they're able to kind of have cavity wall insulation and loft insulation. And as I say, we will put in place grants where we can fund that for people who are eligible. But I think it's just going to be really difficult. I don't think there's any way out of this apart from saying it's difficult. But we're going to have to act, I think, as compassionately as possible as different sectors. One of the issues, slightly wider than this though, are some of our most vulnerable. Coming back to the councillor's point, though, around particularly older people with chronic conditions who are bouncing in and out of hospital for cold home related issues. We see that already. Are we going to see more in the future? Quite possibly. And so this is where the NHS as well can't kind of wash their hands of these issues. There's no point in paying £600 or £700 a night to house somebody in hospital because their own home is cold and they keep having exacerbations of their chronic illnesses. So it's a system-wide issue that has system-wide ramifications and system-wide risk with very difficult solutions, I think, at this point. I've got to hold up my hands, I don't fully understand the proposals from Rishi Sunak and the kind of fuel loans and all that type of stuff. I haven't got my head around all of that yet. I think things are shifting and it's quite fluid at the moment. Do you have any solutions, Lynn?
Well, I wouldn't have started from here. Yeah, I think it's really difficult. We have, I think, as a council, we are looking at support, and we have a number of budget bids with regard to supporting people, like there's the household. Yeah, and you've also got our Director of Finance who's trying to understand Rishi Sunak's thinking, if that would help.
No, I was just going to say, I think that is summed it up nicely. That there's no one golden bullet, is there? It's a multitude of things that need to be tackled. But just to remind members and those members that sit on the Environment Committee, we currently have a not insignificant amount of money that we've had provided to us by government for green homes grants. So that's for a range of works, both in some of our registered housing provider properties and in the private rented sector. And all members of this committee, I'm sure, will be aware of some of the welfare support schemes we've got in place around hardship and utility bills to help people. But obviously, unfortunately, that's for people who are approaching crisis. It's not such a proactive measure. So as a council, we are doing things, but I'm sure there's the problem's far more complex than just for us as a district council to solve. And that's why I think Matt's use of the word whole system approach is critical.
Anybody else? Mike, and then Jen.
Thanks. You've mentioned PCNs, primary care networks. We had the pleasure, didn't we, Len, of sitting at Health Overview Scrutiny Committee, and the two CCGs are going to merge, and PCNs, I assume, will be impacted on that. So I just wonder whether we're, God forbid, starting on another trail of let's reorganise the health service, and that might just impact on let's reorganise local authorities. So how do we compare, or do we have a comparison with what's happening in Herefordshire? Because I can see, certainly the implication of what was said was certain services would be centred in Worcester and others would be centred in Hereford. And I just think that makes life very confusing for people.
Do you have a specific service in mind, or kind of indicators in mind?
Well, for my sins, I was in the health service in Hereford, and they are quite constrained, and they look some ways to Wales, and they also take a lot in from Wales. But I can see more coming across the Herefordshire-Worcester border than perhaps is the case now. And as the PCN relationships develop, I can see practices on the borders starting to think, am I sitting in the right PCN? You know, do I point towards Worcestershire if I live at the top of Frooms Hill, you know, or do I look to Herefordshire?
Through the integrated care system. As we've already talked about, PCNs are themselves still new, and practices do change allegiance. They'll switch PCNs or they'll switch ICS systems depending on how favourable their systems are. I guess that are on the border, and because it is an ICS now and everything is interrelated, they could switch across. It is the prerogative of the practice to say, I like it over there better. I think, though, on balance, having an integrated and combined Herefordshire and Worcestershire footprint gives us more power as a health system. It enables us to kind of do things at scale and to reduce waste. I guess is some of the thinking. Some of it is new, though. It's entirely new. Pooling of budgets and doing things on such a different scale is a little bit untested, so I think we're going to have to wait and see what the impact of that actually is.
Chair, just through you, and Matt's far closer than this to me, but you know, over the last sort of 12, 18 months, the relationships we've developed, in particular with the PCN, I think there's a clear sense that for Worcester City specific, our big PCN is more than big enough as it is. So there's certainly no thirst to want to actively sort of look for services outside of our district to come in. And again, just to give a real positive slant on that, really, you know, some of the work we've done with COVID vaccination clinics, which those two gentlemen at the end have been central to, both Matt and Warwick, they've been driven by conversations that we as a district, I don't think, have had for several years, if at all. So that relationship is really, really good, and the relationships that we've developed with the PCN clinical director and her colleagues sort of really bode well for the future.
Jenny?
Thank you, Chair. I think fantastic document and full of interesting things that I'm going to have to spend a bit of time thinking about. The strategy started today, or it's out for consultation today, and I wonder whether the Worcester Facebook page could highlight it for local residents. I know that as councillors, very often we take things off that Facebook page and plaster them everywhere else on Facebook, and it could be a really good way of getting a good turnout for this.
Sounds brilliant. You know, where you can use your channels, I would fully support and endorse that.
Lynn?
Yes, I was just going to raise it whether we as a committee and as a city council want to look at making a sort of formal response into the health and wellbeing strategy. Obviously, it's, you've presented just the beginnings of it today, whether we want to, take a slightly deeper look, or actually to have a session and to formulate, a Worcester City Council response into that draft strategy.
Intuition. No, I Councillor Denham, totally agree. Our next committee is the 21st of March. So I would suggest that we bring a draft report back to that committee with a draft response on behalf of the City Council, and feeding into that would be a member workshop, which perhaps Matt would be kind enough to come along to, or a colleague, to drive that discussion and formulate a response that we'd be happy with. So Chair and Vice Chair and members are happy with that direction.
I noticed one of the most depressing statistics which you've got in front of us. It's 14.7% of people in Worcestershire suffering from depression, which is considerably higher than the national average. A few years ago, I did a scrutiny exercise into physical activity in Worcestershire. I know, looking at me, you wouldn't believe that, but it was clearly obvious that this was a major problem. Access to people to gain physical activity, to gain access to sport and facilities such as that, is a major concern and major problem. And we created, with the support of Worcester Warriors, schemes about only this girl can schemes in Downs Green, where women could come in and have physical education and fun and training with free childcare. Obviously, funding those schemes have disappeared. But what kind of other access to physical activity can we now look forward to as a result of opportunities which we may want to consider promoting in the future, including with partnership organisations such as Warriors and Worcester Football and other organisations like that, and perhaps even the university?
I think there are, as you say, lots of opportunities to take this forward. Obviously, the District Council have your own sport and leisure facilities as well. Again, it's a holistic response, isn't it? Because it's the obesity, the overweight, the mental health. And actually, just before this meeting, I was looking at some graphics and evidence around, the benefits that walking can have. And it links back into your active travel officer as well, actually, because it's not just kind of losing weight. It improves your mental health, reduces your cardiovascular risk, gets you vitamin D, from sunlight. Helps you to kind of clear your head. It stretches your legs. There's around about 20 odd benefits of just a 30-minute walk each day. But you're right, that won't cut it for everybody. So there needs to be those group activities and sessions and things that will inspire people to get out and do something. So as I say, I think it's a holistic thing. PCNs themselves will have their own activity coordinators, and so they will be referring into those services that people and services that they commission. So again, I think it's a system response to really quite complex and multifaceted problems.
I'm enjoying how, with every response, you're bringing it back to an active travel officer, because you're really hammering home how heavily required one of these is. And it's almost like you've read that terrible article that was in the Daily Mail about it and all the completely ridiculous comments about how we're spending £100,000 teaching people how to walk places.
I can't say that I have seen it, but look, the active travel officer, they're not going to be the saviour of everything. I think we need to set expectation. However, I think that they could play a really, really key part in getting people moving in Worcester City. I think there's opportunity there. So, as I say, I haven't seen the article. Worcester City is not the only place that has active travel, personnel. There is research going on across the country around this very area as well. So, if we can contribute to that, then great. If we can learn from other areas, then all the better. I think it's opportunity that we need to leverage.
It definitely is. I don't think any of us think it's going to be a saviour to all our problems, but I think a lot of us can recognise it will bring a huge benefit to the city. Karen, did you have a question or a comment?
My gym's just started an initiative which I have actually joined, and I should be there tonight, but I'm not, so I'm going to have to go Thursday. And that is addressing your long-term health and your attitude towards food, but it's not necessarily a weight loss program. So I was quite surprised and quite pleased, though you don't get weighed when you start, you just start. So there's no focus on you're overweight or anything, and that's what puts people off. A lot of people, they don't want to face this problem. But if you've got a health issue or anything like that, they'll say, you smoke too much, you drink too much. That's what puts people off, because immediately they'll justify it to themselves or they resent it. You've got to create this atmosphere of them wanting to or something without making it you've caused your own problems. That mental shift towards this is a way to get away from your problems, not give yourself that barrier and put up the shutters and think, you've got to encourage people to do something rather than berate them, basically.
I totally agree. It's counterproductive, counterintuitive to be judgmental about lifestyle. Yet your gym, it sounds like it's a great way to frame exercise, but also, food intake is going to affect your body weight. It's a fairly simple calculation at the end of the day, and if they can frame it in the right way, then great. Let's do more of it.
I think we've probably exhausted everything else. I think if we draw it to a close and let you go home for the evening, because you've been here long enough. But so I guess we're just noting the content of this, and thank you ever so much for coming along again. And it was an incredibly interesting presentation with some rather worrying data. Am I right in thinking they're here to help us? We've stood it down. In that case, Shane, over to you.
Thank you, Chair. Quicker than I thought. Thank you, members. This is the final stage for this committee in the setting of the budget for this coming year. Normally at this stage we'd be looking into and reviewing the revenue budgets for the committee, but as this was a new committee set up post the budget for last year, we don't have specific revenue lines which relate to this. Committed previously to setting that up. We can't do that just yet because our auditors sadly haven't yet finished the 2019-20 audit, let alone the 2021. And until they do that, they've asked me a number of questions about the way that we've structured our finances around the previous reorganisation. So we've got to get that out of the way, and then we'll get on with building a budget for this particular committee. The overall position is still one in which we have a budget gap. I'm pleased to say that the report we'll be presenting tomorrow night at Policy and Resources is a lower budget gap than the one shown at Appendix 1. But nonetheless, there are still pressures. We still have to consider our ongoing revenue commitments, and that's why it's particularly valuable that the proposal which has been presented tonight around the active travel officer is a fixed post to take from reserves, because that therefore doesn't have an ongoing impact on council tax. Obviously, in 3 years' time, we'll review the position and see where we are then as to whether or not we want to continue with that post. If there are no other proposals presented to the committee this evening, then I'm happy to put that forward. And members who will have seen the papers for tomorrow night will note I've provisionally included that in the budget for consideration tomorrow. So I'm happy to rest the report there unless there are any further observations or comments. Thank you, Chair.
Any questions? No? Yes. Richard?
Just very briefly, I accept that we won't be able to make any other proposals tonight for future budget suggestions, but I do think we as a committee need to look at next year and look at options and opportunities which we may wish to proceed with, especially after what we've just heard in areas such as sexual health and physical activity and things like that, which we may want to make future budgetary bids for next year. But I accept that it's too late for this year, but we should have a plan and process to enable us to do so in the future.
Yeah, I completely agree. And actually, one thing that did come out of this report from Matt was what we as a council have got to decide to help people who may feel real increased pressure with the rise of living. Is there anything that we can put in the budget for this year that would help out?
Through you, Chair, we have got an existing hardship fund, and we've got additional money coming through from that. Of course, as has been mentioned, we will have the council tax rebate, although it's not really a council tax rebate, it is a one-off payment to help people out. And there are some existing money that we've had previously for this year, which is still potentially available to help. So there is a range of resources that are available to help people facing hardship. Lloyd may want to say more. In passing, I would mention also that if the public health want to commit additional resources to help support us with things like active travel, then I'll happily receive that.
Lynn, did you have something to say? Sorry, Lloyd.
Chair, I was only going to say that one of the reasons we love Matt is because he gives us loads of money. So I don't know how long we can keep on relying on what we call conf money from public health, what they've had through COVID. But again, that's a real sort of slush of money for us that Warwick and the team are actively deploying where it's needed. So we've also got that sum of money that we're utilising as well to support people in hardship.
Okay, the council tax rebate that you're mentioning there, Shane, is that the £150 for band A to D, is it, that the Chancellor announced this week?
That's correct. Yes.
That's not going to help very much, though, is it, for a lot of people?
It's a question for the Chancellor rather than me.
I'd happily answer that question for you, Chair, if that
I
helps.
know how much my annual council tax bill, and 150 quid doesn't even scratch the sides of it, so it just seems a bit daft. And anything else, Lynn, did you have?
No, I mean, I think Richard kind of raised the point, which is, you know, as when can this committee look at having a budget and what our budget might be, and kind of how we work it out, and how, I guess there's a question about process, isn't it, as well as time frame, and I understand that if you've got to wait for the audit, the time frame might be rather longer than we'd like, but I guess what is the mechanism, and can we at least start to look at the principles of it, even if we can't sign it off?
Through you, Chair. Yes, I've agreed with Mark that we'll start that as soon as we can in the new financial year. It'll be part of the service plan for financial services this year to have a budget built by the autumn, so that the committee have time to consider it and look through it in detail. Okay.
Yes, sorry, Chair. Just picking up on Councillor Udall's point, I think one of the real strengths and powers of this committee is the breadth of things being talked about and being investigated. But I think the challenge with that is trying to pick which flower to help grow. So I think perhaps what we do in terms of the response to the new strategy will perhaps help sort of stimulate some of our thoughts and priorities. But it does feel to me that, you know, in the next couple of months, you know, perhaps by the end of the summer, we need to have nailed down what we as a district want to contribute to, which will support the setting of budgets then.
Okay. Are we all happy with that? Yes? Right. Thank you very much.
Do we need to formally say, if we have our own budget? We did not.
Through you, Chair, I'd counsel against that. I mean, the development of the budget is my responsibility under delegated powers, so I would propose to structure it in a way that I think best supports the committee. So I prefer it if you left that one with me, if that's all right.
I suppose we can give in to that request. Thank you very much, everybody, and I guess see each other in March.